Did you know that most cancer cases happen without a family history of cancer? Today we're busting a common cancer myth that you have to have a family history of cancer to have cancer. So stick around to learn what actually influences your health and what actually increases your risk of cancer. I'm Dr. Del Rosario. I'm a clinical oncologist passionate about cancer care. And I've started this YouTube series to discuss common cancer myths that cause a lot of fear, misconceptions, and misunderstandings when I see patients and their families in clinic. The goal of this series is simple. I just want more patients and family members to understand more about their health and make better decisions for themselves and their loved ones. So if you like this video, please subscribe for more, and let's get to it. So I get this thing that many people say to me when they have a new diagnosis of cancer, that, "Doc, no one in my family has cancer. Why me?" Or they say, "I don't have any family history of cancer. How come I have cancer?" Well, this is a common myth that I see a lot. And unfortunately, just because you don't have anyone in your family with cancer does not mean that you will not get cancer. It's easy to assume that cancer is genetic, but that's only part of the story. So here's the reality check. There are several different cancer risk factors that can cause cancer in you. First, let's get this one out of the way. Genetics. Only 5 to 10% cancer cases reported in the United States are related to family history. The other choices are lifestyle, such as smoking, obesity, alcohol are common ones. Environmental would be radiation exposure, asbestos, or other environmental risk factors like chemical hazardous waste. Or if you're in the military, any exposure to chemical warfare like Agent Orange. And lastly, there are random mutations that can happen in your body that happen over time as cells divide and grow. And unfortunately, that is a common one. I just want to emphasize that most patients have no family history of cancer. But just because you don't have family history of cancer does not mean you are not at risk. Family history of cancer does cause certain types of cancer that doctors and you as patients and family need to know about. For example, there is the BRCA mutation in breast and ovarian cancer. This happens in women. Usually they have several siblings, typically with a history of breast or ovarian cancer. Typically happens younger. Typically happens over several generations. Another common one is something called Lynch syndrome. Lynch syndrome is related to colon cancer. Typically, these patients present very early with colon cancer and may be related to other types of cancer. And this is also seen over several generations in their family. But don't be alarmed. Having a family history of cancer doesn't guarantee that you will get cancer. It just increases your risk. So what can you do to reduce your risk of cancer? First of all, it is the most obvious thing that our grandmothers all told us. Just live a healthy lifestyle. Eat whole, real foods. Avoid processed foods. Exercise regularly, at least 5 days a week, 30-minute sessions at a moderate intensity, minimum. Avoid alcohol or drink alcohol in moderation, and avoid smoking cigarettes or tobacco use. Another thing that we can do is screening and early detection. So just make sure you follow with your primary care doctor, but common ones are to get annual mammograms for women over 40, unless they have risk factors for cancer earlier, or colonoscopies to get started at 45 and every 5 to 10 years then after that, unless you have a family history of colon cancer. Another obvious one is just to know your body. If you notice any unusual lumps, rashes, or anything like that that occurs over time and persists, please see your doctor about it. And lastly, common vaccinations can prevent certain types of cancer. For example, the HPV vaccination in cervical cancer. So cancer isn't about genetics. It can be part of it about 5 to 10% of the time, but there are several different lifestyle and actions that you can do to prevent and or reduce the risk of cancer. So you want to talk to your doctor so you can get ahead of the risk and make sure that you're ahead of the game. So if you like what you see, please like, comment, and subscribe for more. And let's bust more cancer myths as we continue on in this YouTube series.